Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our special guest today is Dr. Jennifer Pearlman, a functional medicine physician with a medical practice focused on women's health and wellness. We'll be back with our interview after this brief message from our sponsor.
Hey there, listeners. It's your host of the weekly podcast, Redefining Medicine. I have a question for you. How much time do you spend ordering functional lab tests for your patients? Ordering from multiple lab companies for hundreds of patients can quickly turn into hours of admin time. But there's a new way to order lab tests that I'm excited to share with you. Rupa Health is a tool that lets you order 20 plus specialty labs in a single portal. You can order all tests you normally do from companies like Dutch, Vibrant, Genova, and Great Plains, and so many more. Imagine you're ordering a hormone panel for a patient that includes tests from 3 different labs. You have to log into 3 different websites to place separate orders and then come back weeks later to check tracking number and download results. Rupa eliminates all of that by having all ordering, tracking, and results in a single place, and they also handle invoices, tracking shipments, automated follow-ups, personalized instructions for completing tests, and so much more. The best part about Rupa, it's free for all practitioners. Go to rupahealth.com, that's RUPA health.com, to join a live demo or sign up to see how it works. Now let's get back to today's show.
I am so pleased to welcome Dr. Jennifer Pearlman to the podcast today. She is a medical doctor with a focused practice in the area of women's health and wellness. Dr. Pearlman also has cultivated an expertise in the art and science of cosmetic medicine. So welcome today.
Thank you, Melissa.
Thank you.
It's great to be here in Las Vegas with you.
Yes, it's great to see you and have a conversation about your journey to anti-aging medicine. Can you share a little bit about that?
I think probably like a lot of the functional medicine physicians that are part of this community, it's been a personal and professional journey intertwined in that ever since I was a little girl, I was very aware through my own personal experiences. I was a dancer, and my personal family's health experience, I had a father who unfortunately had a heart attack at a very young age, but was the picture of good health, lean, fit, and athlete. And so my personal experiences sure showed me that things like genetics, nutrition, lifestyle really factor into health, disease risk, and aging. It turned out that my father's early heart attack was largely attributed to a genetic risk that we had to cholesterol problems, a risk factor, of course, for heart disease. So I was brought up on a special diet. Now we know it was all wrong. It was a low-fat diet, but the happy side effect was that I ate very clean. When I got to medical school about 2 decades later, I realized, gosh, this is really sick care, and there's no instruction or engagement with the health style of our patients. And I knew that eventually to practice the medicine that I wholeheartedly believed in, the medicine probably like a lot of practitioners here, I'd have to build the new model myself. So that was exciting to me because at the end of the day, I do consider myself an entrepreneur, and happens that the business or the industry is healthcare, and the ability to build something that would allow the delivery of care in a way that I saw most appropriate to meet the needs of patients has been the essence of my career for the past 2 decades.
Would you like to share some of the steps of how you got there and how long it took to get to where you are today?
It's honestly an ongoing process, and I think a key personality trait that I've always had is a curious mind, being inquisitive, and having a strong desire to continually learn and do more better. So traveling to medical meetings around the world, in pursuit and search of best, techniques, practice, technologies, to ensure I'm always on that leading edge, but not the fringe. And that's been how I define my practice very much, that it is the intersection or the bridge of the best of conventional medical care and that which is, I believe, the medicine of the future. So I would say part of it was good timing. You know, I graduated medical school the year the human genome was decoded. I was a medical student working with the original investigators that discovered cosmetic Botox.
Wow.
And then, you know, just the ability to build a practice when the Women's Health Initiative was first published and create a real divide for many of my women, my patients, between the options that sick care or conventional care had been kind of spilling over to them and that which might be accessible with a more holistic approach. And so timing's key, but the medicine I practiced when I graduated medical school or early in the establishment of my holistic health practice is but a fraction of that which I do today. And I can only imagine that what's to come in the next 10 and 20 years of practice, which I plan to be a big part of, will be completely unrecognizable to, again, current medical care.
Wow, amazing. So what are some key tips that you usually give to your patients for keeping a healthy lifestyle, healthy skin, and everything in that regard?
Well, as you know, I run sort of a dual practice based on the belief that beauty comes from within and that we look good when we feel good. So in other words, health, optimal health, vitality, and well-being is critical to looking your best, whether it's your skin, your face, your body. Two different sides of the same coin of healthy, beautiful aging. So one of the first things I do, regardless of where I'm meeting a patient, whether it's a rejuvenation treatment, a cosmetic type of treatment, or whether it's looking at hormones for women in, you know, the perimenopause, it's approaching a patient with a highly individualized, very comprehensive, so enveloping them with the best medical care technologies, techniques in a way that is conservative, recognizing that for everything, including food we eat, there are risks and benefits in a process that's highly dynamic and responsive because, you know, there's no magic bullet to health, beauty, or aging. And we can refine over time in a way that is a partnership. So when I always tell patients, conventional medicine's paternalistic. There's one fix, you got to go do it. Whereas holistic care in my practice is a partnership. And I require the engagement and the hard work of the patient and also their feedback so that we as a care team can do more better for them over time.
Okay, that makes a lot of sense. Also, I'm very interested in hearing, and I'm sure our audience is too, just a little bit of an overview from your lectures from the 29th annual A4M Congress.
So two very different lectures, but ultimately I think they are both critical parts of ongoing success in any medical model, or frankly, any advanced industry that is offering the very best treatments and technologies. My first talk had everything to do with people and practice management, how to build your dream team, a high performance team of employees and colleagues that will be able to deliver the care, the customer experience, and the level of service and professionalism that, you know, I, for instance, as a provider, want to uphold. And I feel, though it's an ongoing process, that having that high-performance team of brand ambassadors is such a critical piece of ongoing success. And the flip side of that, you know, the other people group that is your greatest asset are your customers for life, your loyal, trusting, referring customers. I mean, I use the word patients, that, you know, when you focus on their outcomes, their safety, their experience, their engagement, one by one, they build your practice such that I am not one to put billboards up or invest in marketing, but rather focus and have grown my practice one patient at a time. And the other talk yesterday was hottest trends in aesthetic medicine, which, you know, I think is a defining part of my practice, that I'm an entrepreneur and innovative. I've developed several of my own techniques. I've been first to market with best-in-class technologies, offering, you know, the next-gen types of treatments for even surgical results, surgical type of results, but with little to no downtime. And I've been able to do that as first in Canada or North America in some cases, because I'm able to apply a critical thinking approach, always looking for not only what's hot, but what's safe and most effective. So the hottest top 10 aesthetic trends was my second talk.
Okay, yes. Thank you for sharing. And with everything that you're doing, what is one thing that you would really like everyone to know about you and for you to be known for?
I developed this concept, ageless vitality, about 18 years ago, at a time where my husband, still my husband today, said no one knows what the word vitality means and how can you use that word. Of course, fast forward, it's much more of a buzzword and people are familiar. But I would say if I was to be known as, you know, the woman to go to for this, it's having this extraordinary scope, skill, expertise, and experience to help you live your best life, to age well, and enjoy a health, not just lifespan, but a health span that is rewarding and fulfilling, no matter what your goals are and no matter what your stage is. And so, you know, being, I guess, like, you know, that aging expert, whether it's from the inside or the outside, top to bottom, and particularly when it comes to the unique challenges, intricacies, and complexities of aging for women.
Wow. Well, thank you for sharing that. That's a wonderful answer, and thank you for all of your knowledge and insight today. It's been a pleasure speaking with you.
Thank you for having me. It's so great to be here with you.